Hello, I'm Timothy Nichols. I'm 58 years old and I live in Vineland, New Jersey. And I like to do woodworking. I like to go down to my wood shop and make things. I make tables, I make decorations and stuff like that. I'm working on a hope chest that my wife got. I'm refinishing it and staining it and painting it. I enjoy it because it's just so relaxing. It's quiet, peaceful, it's relaxing to me. I had been in the hospital for osteomyelitis on my right foot. My foot was all swollen. I had a little blister on the top of my foot. The doctor popped it, cleaned it up, and wrapped it, and I've had diabetes for many years. And diabetes is very bad if you don't keep it under control. If you get a wound, it's very hard to heal. And sometimes you get infections, and if you get an infection, it's not caught in time, you could lose a limb. So I went to urgent care. The doctor looked at it and he says, "You need to go to the hospital." And he opened the wound, drained it, cleaned it, wrapped it back up. It was a mess. The doctor sent me to Inspira Medical Center, Elmer, to be admitted for IV antibiotics to help heal my foot. So the first skin graft that was done in the hospital failed. My wife recommended that I go to Elmer Wound Care and have my foot looked at there. So I called and made an appointment and went in. I was going back once a week to have it checked and change the bandage. And in between, my son, when I'm home, my son would change the bandage because it had to be done every other day. But after a few times, the doctor decided the wound wasn't progressing anymore. So he said he would recommend hyperbaric oxygen treatment. The staff at the Hyperbaric Center helped me very well. They sat me down, we talked. They explained everything that was going to go on. I got the chance to talk to a patient that just finished hyperbaric treatment. And he explained everything to me. He said, "It's a piece of cake." He said, "All you got to do is just lay there and breathe. It really works," he said. I said, "Okay, I'm going to give it a try." And it's the best thing I ever did because I could have lost my foot if I didn't, or worse. The time commitment is 2 hours a day, 5 days a week for 6 weeks. I was kind of leery at first, but then I started seeing progress every week. And finally, 10 months after I first had the problem, I finally was able to put a shoe back on my foot. And I'll tell you, that wound was very debilitating because I couldn't walk on it, I couldn't keep pressure on it. I couldn't do hardly anything. Hyperbaric oxygen treatment is wonderful. It's been amazing. And all I can say is thank you, Hyperbaric Oxygen Treatment team. You're wonderful.